Hello everyone and welcome back to another episode of Your Absolute Mind. I'm your host Paula Sweet, and today's episode is another interview talking all things mental health within the workforce. In today's podcast, I'm speaking with Tim Mitchell, the head of staff and culture at the Oxford Business College. Now, before we go into the podcast, just a little bit of information about Tim. Tim is an experienced Chief People Officer and HR Director, follower of the Chartered Institute and Personal Development with a Master's degree in Law. Tim specialises in creating, shaping and delivering world-class employee experiences, ensuring that organisations are future-proof to succeed through periods of development and growth. He's got over 25 years of leadership experience in HR across private and public sectors, working with both large-scale businesses, non-profits, founder-led organisations and private equity-backed ventures, with the last 5 years being in higher education. Tim is also a Governor Director for a Church of England primary school in Bedfordshire. Now, he also has a long-standing interest in supporting mental health in the workplace, and in April 2025, Tim will be running the London Marathon in aid of Rethink Mental Illness. Now, if you want to support this amazing cause and Tim, you can do so via the link in today's podcast bio. Just be sure to support Tim and his charity of choice. Now, on to our conversation that we had. During the conversation, we discussed what companies can do to support mental health in the workplace and strategies that work best at supporting employees. Now, as always, before we go into our interview, I do want to say a massive thank you to Tim for his time, his expertise, and his own personal insights into mental health. Now, before we go into it, a little bit of key points and takeaways of what we discussed. Now, in this podcast, we're going to cover the importance of recognising how employers can better support their employees with varying mental health struggles. We also discussed unique challenges that employees and employers face within the workplace, strategies that have been used within workplaces for mental health that have helped, and also strategies that haven't helped quite so much. Not only that, we discovered some of the misconceptions that employers have regarding mental health for their employees, the responsibility that organisations have in supporting their employees, and we also discussed some practical steps that employees can take to create a more supportive environment for the workplace. Following that, we then discussed how organisations can ensure that mental health resources are not only accessible, but effective and easily accessible. We also discussed some of the long-term changes that are necessary to improve the landscape of mental health for employees. And another big thank you to Tim, because he also shared his personal experiences with some struggles that he's faced in the past. So thank you, Tim, for that. Now, I really enjoyed my chat with Tim, and I do hope that you enjoy this podcast too. So let's get into mine and Tim's chat. Like I said, I'd like to thank you, Tim, for coming onto the podcast. If you don't mind, if you could just introduce yourself, tell us a little bit about you and your professional background and who you work for and what you do there.
Yeah, it's a pleasure to be here. So thank you for inviting me. My name is Tim Mitchell. I'm head of HR and culture at Oxford Business College. Been here probably for about 4 months now, but I've got 25 years HR experience, chartered fellow of the Chartered Institute of Personnel and Development. For the last 10 years, I've been in various roles covering public, private, not-for-profit sectors. Lastly, the higher education sector, where I've been in various roles ranging from Chief People Officer to HR Director.
Fantastic. And what inspired you to discuss the topic that we're talking about today? So what companies can do to support mental health in the workplace and the strategies that work best at supporting employees. What inspired you to pick that option for today?
For me, it's mental health has long been a taboo subject and probably still is in a number of areas to a certain extent. And certainly there's a lot that employers can do to really change that mindset. I heard a stat recently, I can't remember where it was, but I heard a stat that at one point during the year, it's likely that 1 in 4 Britons will experience mental health issues. And obviously it's no hiding the fact that the conditions and environments we provide in the workplace can either contribute positively or negatively to people's experiences, both in work and outside of work. So for me, this is a highly important topic for us to be discussing. We need to normalise the conversation, and mental health is a subject that I am interested in. And for example, even next year, I might be mad, but I'll be running, crawling, staggering, whatever you call it, the London Marathon,
Oh, wow.
for Rethink Mental Illness.
Wow.
So it's an important subject, and one that I'm obviously proud to be talking about with you today.
Yeah, fantastic. And I do think, like you said, within the workplace, we spend the majority of our time, don't we, in a workplace. And if you can learn some strategies, if you can have support in a place that you go to day in, day out, then that surely is going to help in your other side of life, your family life, your social life. And if we can gather an all-round support, then surely that's going to help everybody going forward. So I think definitely talking about workplace mental health will definitely help people to learn some strategies, or even just help companies to implement and understand how they might best help their employees. I think that's a really big important thing that we need to understand more of. But have you got any either unique challenges that you've seen or experienced yourself within workplaces, whether that be your current role or your previous roles before? Is there anything that kind of stands out to you that you've seen as a problem within the workplace?
I think for me, we need to understand in workplaces that everyone is different. We all have our own mountains to climb, and those challenges are going to be different for person to person and organisation to organisation. Obviously, going back a few weeks now, we had a challenging few weeks with protests around the country. And that obviously caused a lot of challenges, both from a safety point of view, from a mental health point of view, for a large range of employees, especially for an organisation such as ourselves, where we do have a diverse staffing base. That obviously posed challenges that we don't see too often. I even during that time saw examples of some companies who apparently refused to let employees work from home or leave early when they wanted to for their own safety, which obviously caused anguish and issues from their side. And we just need to understand that people are unique, and we need to support them in every way we possibly can. Given people's unique challenges, obviously over the last 25 years, I've seen a range of conflicts that have challenged mental health in the workplace, ranging from just what general workplace conflicts to even in the rise of social media, people putting in grievances and complaints because they've been unfriended on Facebook. So things like Facebook, social media, WhatsApp, and the ease of messaging is obviously going to give everyone some unique challenges that we're all going to have to work through. So obviously it's important for us to ensure our policies are structured correctly, that we guide employees in the right way to support everyone as best we can.
Yeah, of course. And it's interesting, isn't it, how the world is changing now. There is more access, and you mentioned social media, and it's a very different place, not only the world that we live in, but the workplaces now. I do think there's a lot more struggles and challenges that people are facing. So it's a bit of a minefield, really, isn't it, I think, for a lot of people.
No, exactly. And obviously the rise of work from the office mandates and return to work mandates will have an effect. And obviously I touched on protests that we had a few weeks ago that obviously caused challenges on people and companies that have been, for whatever reason, yes, we've got to be in the office, and not supporting people in the right way. Obviously does impact on people's mental health. For example, in our case, although we are a work from the office organisation, that doesn't mean you can't be flexible. That doesn't mean you can't support employees in the right way. And during that particular sort of week and a half, where it was necessary, we worked with the authorities and understood where those challenges were to ensure our staff safety.
Brilliant, brilliant. And I think it's that flexibility, isn't it, within the company of, like you said, trying to be flexible for the ones that need to be able to work from home, give them the support that they can from a workplace, and then also they can implement their own things for themselves. I think working within mental health and understanding the importance of a company giving support, but also the actual individual having their ability to voice, their ability to understand and learn for themselves. So I think that's a really important thing to note for people, is work support is important, but also you say when you're uncomfortable, you're able to have that voice to say, hey, look, I need some help here. Can we maybe do this? And I'm going to implement this from home as to how I can better help myself as well. I think that's really, really important factor.
No, exactly, and certainly as employers, we've got a responsibility to foster that conversation, to enable that conversation. There certainly needs to be less scaremongering and more responsibility taken by us as employers, because just because someone's struggling, it shouldn't reflect badly on them. If anything, they should be applauded for speaking up, and just simply asking staff, how can we help? Goes a lot further than you could than you possibly think. Just that simple question can, from an employer's point of view, impact your employees' happiness, retention, and performance, and probably just as importantly, depending on the industry, and customer happiness, retention, and performance. Because if your employees are happy, they're going to represent your brands better. So it's about normalising that conversation, and we've got that responsibility as employers to prioritise that awareness, provide support mechanisms, and signpost those effectively for our people.
Yeah, of course. Normalising the conversation, definitely. I mean, I'm of the belief of within a workplace, not only that it's not like just the managerial role that should be giving that support, but I believe, and I may be wrong, but having the whole team of employees openly discuss as well between themselves, like, hey, look, I've learned this strategy today, like maybe this could help you. Not just having to go to your manager, because not always is a manager readily available because they've got their other tasks that they need to do. So maybe it comes down to having a network within it's like a culture, isn't it? Create that healthy culture within your whole force, and then that builds the better foundations for everybody.
Yeah, no, I completely agree.
Now, from your experience, the strategies, we talk about strategies that can be put into place to help people within the workplace. Have you seen or have you implemented strategies that you can say, this worked really well for our team? This helped the mental health issues that we've seen. Is there anything that has worked?
Yeah, so from my perspective, the strategies that seem to work the best revolve around that flexibility. And going back to what I was saying earlier about everyone being unique, it's understanding people's uniqueness. So it's having that flexibility to support individual needs effectively, whether that's through childcare, care and responsibilities, general well-being. As I alluded to, just because you're a work from the office organisation doesn't mean you can't support and you don't support employees effectively. So by allowing people to work around their commitments in an effective way so that they can not have that burden on their minds. Employee assistance programs, obviously that's a common one that most organisations use now. I've seen some organisations, and I've worked for organisations previously that have allowed, on top of annual leave commitments, a certain number of mental health days each year that can be paid and doesn't affect their payment. But ultimately, anything that encourages a safe space, encourages that openness to talk about things and that normalising of the conversation has got to be a good thing. So, for example, within Oxford Business College, we're obviously a student-facing organisation. We have counsellors within the organisation for our students, but actually we also allow our staff to use those same counsellors. They represent the staff as much as they represent the students. Just as a practical example, it's these, and I accept that's something that as an educational establishment we're able to do because they're the type of roles that are commonly seen. But to focus that not just on the students but on our staff as well, and allowing them that space to be able to have those conversations with someone is vitally important. We have individuals within the organisation who focus on well-being. We encourage people to get up and about and move around, because
Yep.
you can be sat at your desk from 9 o'clock in the morning, and then all of a sudden it's 4 o'clock and you haven't shifted.
Yes.
So we encourage that movement and that getting out and about, and certainly also within our systems, we allow within that there's the option for people to sort of go on breaks. So they put their laptop on a break period, and they can just get away from things for a little bit. So these are some of those practical things that that employers are able to do, and some of the things that actually we've been doing recently that seem to go down well with employees.
And it's very interesting, because even just a short break, I totally agree with the have a little bit of a break, put your laptop down, go and walk around the office. If you've got the ability, just step outside and take some deep breaths and get a bit of fresh air. That it's almost like a mental reset, and it's something that I think is so simple yet can be so effective for people when they are in a continual workplace, to alleviate the stresses. Because I think people don't realize just how much sitting at your desk from the moment you get in to the moment you go home without really having effective breaks, how much that can build on your stress levels. I love encouragement of short meditations throughout the day as well. Go for a walking meditation. It doesn't have to be an eyes closed thing. You can pop on some headphones, pop on a 5-minute meditation that's all about de-stress and let go of any anxieties that you're holding on to. Come and sit back down at your desk, and then you're in a whole other space mentally to be able to tackle the rest of your day. And I think that's a very positive thing that you're encouraging within that workplace.
No, exactly. And you don't need to be we use the common example, people use a Google that has all singing, all dancing things for employees to use in their office spaces. Don't get me wrong, we are a education establishment, so we have breakout areas for students that staff can use as well. But you don't have to be a Google type company, a tech company that has all these all singing, all dancing things. As you say, it could just be getting outside for 5 minutes, walking away from your desk for 5 minutes and going to get a coffee or something like that. It just needs to be as simple as that sometimes.
Yeah, absolutely. And then on the flip side of that, have you ever experienced strategies that just have not worked and perhaps maybe even negatively impacted the workplace mental health, even though it was intended to have a positive effect?
Yeah, I think not that I've experienced personally per se, but obviously in the industry I work in, and it's been widely reported in the press recently, the increase of mandated return to office just does not seem to be working in all cases. A lot of companies come out with the right words. We're trying to encourage collaboration. We're trying to encourage people getting together. But when you don't explain the whys and the wherefores and the reasons for mandating something like that, when employees don't understand it, that's going to have a massive negative effect. And I'm not saying a return to office and having an office-based environment is wrong or right. It's when companies, and we've seen some of them, are mandating it, and just no one understands why they're forcing everyone back into the office, and they're not explaining it properly themselves. But then on the flip side, fully remote can also have the same effects, because whilst being 100% in the office gives people anxiety and concerns about the time away from family, their work-life balance, childcare commitments, caring responsibilities, being fully remote can also have the same effects, where individuals mentally like being around people, like to have that human interaction. It's about finding that balance. It's about ensuring that we are handling it in the right way, asking employees actually what works for them. You alluded to it earlier in the conversation, just having those conversations with people of what works for you, what work environment will help you succeed the most. There will be organisations like us that are student facing, therefore we need people in the workplace. But on the flip side, it's where those who, people could be doing their roles remotely, and the companies are forcing them back in just for what seems to be just because they want to. It just shows a lack of empathy for the workloads, the long hours people are putting in, inflexibility, and maybe people just feel that their skills aren't being utilised effectively. These are all things that you've just seen don't work.
Yeah, absolutely. I mean, doing the work that I do, I can see both sides of the argument for the employees, the employers, the importance of being around people. So I totally get that. I understand why they might want to get people back into the workplace. And like you said just previously, that it's the conversation of that this is why we're encouraging you to come back into the office space, because people do need people. We do need human connection. And then I also see the whole isolation of being fully remote. Yes, it creates... It's almost like a whirlwind. So it creates this, people think that working from home all the time remotely is far more beneficial than anything. But actually it does create some elements of isolation, and then the inability to connect with our co-workers. So it's again, it comes back, it's that minefield of what is right and how do we do this? Because there is a positive and an argument for both sides of that. I love being around people, and more often, I'm a therapist, so I work on a one-to-one basis. So I do get to interact with people on a daily basis, but there are parts of the job that are also isolating because I don't get the office crowd. I don't get that. I work on a solely one-to-one basis. And there's sometimes where I think, I would love to have that element of being in an office with people. I'd love it. And then there's times where I go, actually, I really love what I do because I do work from home. I do have the ability to be around my family, be more flexible. So I'm very fortunate to have both things. But yeah, I've got an argument for both sides. I think doing the work that I do, I see the importance of both of them.
Yeah, no, I can agree with that, and certainly we in Oxford Business College, we've got the ability to obviously make sure that we're treating people fairly. We've got a number of colleges throughout the country, so it allows me and my team the ability to let's get everyone's postcodes, let's link that to where their nearest site is, and actually make sure that as far as possible, whilst respecting the skill sets they've got to do, the academic specialisms that are required from campus to campus, that we're placing people to work at campuses that are within a reasonable commuting distance of their homes, so that they're not spending 2-3 hours on a train getting into central London or something like that. We're actually targeting where the best campus for them to work from could be, to ensure they're not having to commute ridiculous amounts.
Yeah. Absolutely. It's that commute, isn't it? I think I spoke to my husband this morning, and he'd gone into his local office, and that took him an hour and 20 minutes, which really in reality it should have only took 40 minutes. And then that sets you up for a stressful day because you're thinking, oh my God, I just want to be at the office now. I need to be, but it's took me double the time it should have done. So trying to get people in the most local areas and places of work is far better than going, you need to commute 2-3 hours to get into the office. It comes back down to that flexibility, doesn't it, of giving them what works best for them.
Yeah, no, exactly.
Now, what, in your eyes, your perception, what are some of the common misconceptions that employers might have about mental health needs for their employees?
Certainly for me, as I alluded to earlier on in the conversation, mental health is still in many circles seen as a taboo subject, and that anyone struggling is unable to do their job effectively, which isn't the case. We need to normalise the conversation. Just because someone's got struggles and is challenged in certain areas, it doesn't mean they're not effective in their role and can't be effective in their role. It's about normalising that conversation, creating that safe space for people to have those open and safe cultures to be able to change the narrative. It's not a sign of weakness. There's still that view in a lot of areas that it's a sign of weakness.
Yes.
A lot of organisations think, I need to put a certain amount of pressure on people because that will drive performance, that will drive productivity. It'll enable us to hit our targets in the right area. And to an extent, when done properly, I understand that, but too many employers use that as a stick to beat people with. And you've got to get that balance. You've got to get that balance is key. You can't go too far excessively and not give people the tools to succeed, the time to succeed. Creating those cultures, if organisations are doing that, that feels like micromanaging. People in this day and age want that agency to be able to work through their plans in the way that works for them, to come up with their ideas, to support them in achieving their best. It's normalizing failure to a certain extent. And whilst I don't like that phrase failure, that's how we learn. If we normalize the fact that it's okay to make a mistake, because just use it as a learning process and a learning method, it allows people that freedom in their minds to get enjoyment from their job, because they know they can bring their best, they can bring their ideas, they can bring their views to the workplace, and know that it's safe and welcome for them to do so.
Absolutely.
But the main thing is it's changing that narrative. It's making sure that those conversations are able to be had in a safe way. It's changing that misconception that mental health challenges means people are ineffective at their roles, that they can't operate at senior levels, et cetera, et cetera. For example, just to use me as a example, it's been 2.5 years since I last placed a bet. I am, always will be, a gambling addict. But it's been 2.5 years since I've last placed a bet. Doesn't make me any less effective at my role. Doesn't mean I can't focus in the workplace. Yes, it's had effects in the past, but we need to normalise that conversation. We need people to realise that actually it can affect anyone in various different ways. And by normalising that conversation and encouraging people to speak up, and as I say, people should be applauded if they feel able to speak up and for being able to speak up, as should employers for creating that space that allows people to do so. We need to remove that stigma, and it's not going to happen overnight. It's not going to happen just because we put in place a employee assistance program, or we provide you a counsellor you can speak to. That's not going to change the narrative. We need to go back to the drawing board. We need to look at everything that we do as employers, and also we need to look at things we do as a country as well. And I'm not even going to touch on the political conversation because I'm not qualified enough or knowledgeable enough to know about that. But the challenges that people have in accessing mental health support mechanisms within the UK as a whole is causing challenges and does cause its challenges. And whilst, I think we can all welcome the news coming out from government circles that, yes, they are going to put funding into improving that service, it's still a difficult service for individuals who need to get access to.
Absolutely.
So there's only so much employers can do.
Yeah, absolutely. And that is it, that actually leads us on to the next question that I was going to ask you of, the responsibilities that organisations have in supporting mental health of employees. That there comes an element where it's not all down to the organisation, is it? That there's other elements that is definitely lacking, like you said, the NHS side of things. There's a responsibility within the individual themselves to be able to implement things, and then the organisation puts things into place. Again, it's that multifaceted problem that I think as long as organisations are doing everything that they can, and then the employees go, okay, you're giving me this support, so now I'm going to make sure that I implement everything that I possibly can, because from doing the work that I do believe there's an element where there is a lot of things that people can do for themselves individually that will help. And then with the added support from their organisation, their business, it just creates a compound effect of better mental health, because there is that whole argument of there is only so much that a workplace can do. It has to be from all angles that support comes in, or at least trying ourselves to implement those things.
Yeah, no, exactly, and certainly from a responsibility point of view, that goes full circle. It's everyone's responsibility. But ultimately, as employers, there needs to be less scaremongering. We need to take responsibility to get away from that culture, and really promote that just because someone's struggling does not reflect badly on them.
Yes.
As I've said before, just a simple question of how can we help you? How do you need to be helped? Can go a lot further than people actually realise and think it can. We just need to normalise the conversation. We need to make sure that we're creating safe spaces for people to be able to talk about the challenges they're facing and be willing to help them, be willing to support where we can and where it's practical to do so.
Absolutely.
But there's always support that can be given in the right way.
Absolutely. And what do you think are some of the practical steps that employers can take to create more support, more of a supportive environment for employees? You know, again, I suppose it comes down, is that all, I think I alluded to it earlier on in the conversation, is that down to managers, or is that down to, yes, it starts with managers, it starts with the hierarchy within the company, but does that then need to filter through to the staff, the office staff, to create that environment, that culture of opening up conversation? For me, if everybody's learning strategies and tools to help themselves, again, that then can feed into the environment of, look, this might help. And then that gives the support of, manager might not be available, but I can go and speak to my colleague across the way who I know they've had struggles and maybe they know things that might help me. You know, it filters down, doesn't it?
Yeah, no, exactly. And yeah, whilst we've used the phrase a few times in this call, we need to normalise the conversation.
Yeah.
It's all well and good creating those cultures, but we do need people to speak up. We need people to speak up as to actually, we think we're doing the right things, but challenge us. If what we're providing and what we're doing doesn't support you as an individual, tell us that there are other things we can do. That we know there can't be a one-size-fits-all for everyone in normalising the conversation. So we need to all be taking a real critical look at our policies, procedures, especially in relation to EDI, and how they support everyone within the organisation, how they allow everyone in the organisation access to all the options that any employer has. Training managers and staff is critically important in making sure we're promoting the awareness and support. And I deliberately say staff as well, because as you mentioned, it's not just down to managers. It can't just all fall on managers. Staff need to be aware. Staff need to be aware of what they're looking for. In educational establishments, for example, we do and spend a lot of time on safeguarding training. So individuals at all levels of the organisation know what they're looking for and know how they need to support individuals where that's needed. But it's making sure that the support's there for those people as well. So the rise of mental health first aiders within the workplace, that's all well and good, but you can't just put mental health first aiders in the workplace, train them and say, here they are.
Yes.
This is who they are. There needs to be that support mechanism for those first aiders, because they are going to come up against some real tough, sensitive subjects.
Yeah,
that
absolutely.
That is going to have an effect on them as well.
Yeah.
So practically, we need to be providing those support mechanisms to the mental health first aiders themselves. Otherwise, they're not going to be able to do their jobs properly, and they could get adversely affected by some of the stories and situations that they find themselves put into just because they want to help people.
Yeah, absolutely.
But listening to the staff's the key.
Yes.
We can't have a one-size-fits-all. We need to listen to our people and understand actually what do you need?
Yeah.
What do you need?
Absolutely. What do you think is the most significant barrier to improving mental health support within the workplace? Is it a funding thing? Is it a people thing? What do you think? Whether you've experienced it within your roles, or whether just a personal view of what could be the barriers to better mental health?
And funding clearly is an issue. We all know organisations, regardless of size and scale and area they're in, will have funding issues, will have budgetary constraints. So, yeah, that's obviously, of course, going to be an issue. But I think ultimately it comes down to sometimes a lack of understanding of what can be done that actually practically doesn't really cost a penny.
Yeah.
In supporting individuals within the workplace. So whilst funding, yes, obviously it's going to be an issue because people will be worried about budgetary constraints. There's a lot that can be done that doesn't actually impact on that. So it's making sure you're managing your policies effectively. So bullying, discrimination, harassment, lack of autonomy in roles and responsibilities. These are all things that employers we can impact without impacting budgets and without needing to find out of 100,000 to put a whole mass worldwide training program in place or anything like that. These are things that can be done strategically by understanding and having effective people teams that understand the issues within the organisation and track the issues in the organisation. We can identify hotspots where, oh, hang on, in our employee surveys, we're seeing that X percentage of employees from X location are all saying the same thing. We can see a spike there. Let's put some interventions in place that allow us to impact that positively. That doesn't cost us a penny.
Yeah.
And it goes a long way for staff to see actually they're listening to us. And it goes back to comments we both made earlier that listening to staff to what they need and what they want is the key thing.
Yeah.
One of the biggest impactors on staff welfare and mental health to an extent that I've seen is all these employee staff surveys and engagement surveys that take place, and we all do them, but it's when no action's taken. You spend half an hour as an employee doing this survey, and then it gets assessed and you get the feedback, and they say, right, we're going to do this, and this. And then a year later or 6 months later, there's a pulse survey and nothing's been done.
Yeah.
And employees just go, why do I bother?
Yeah.
Why should I even speak up and give my views when you're not even going to listen to me? So it's having those listening ears and really impacting and practicing what you preach. If you're going to ask people what they need in the workplace, listen to them.
Yes.
I'm not saying you have to do everything, because it's not practical to do everything, but explaining why you can't do certain things, but we can't do that, we could do this. Would this work? People not feeling listened to will just make them switch off.
Yeah, absolutely. I couldn't agree more. Couldn't agree. And have you got any success stories, either personally or that you've seen within the workplace, where improved mental health support has made an actual notable difference, whether that be for one individual or for a whole team? Is there anything that you can share with us?
It's obviously difficult to share specific sort of outcomes and situations. So as we've said, we want to normalise the conversation. We want to make people feel safe to speak up and things like that as well. So what I would say is where I have seen real successes is where you're creating that open culture where people can talk to each other, whether that's peer-to-peer, whether that's with specialist supports through counsellors, through employee assistance programs that have been put in place, and you can see the usage that people are partaking on that. But for me, it's making sure that we're not relying on outsiders to drive that behavioural change. Any behavioural change has to come from within the organisation. We need to be showing that as leaders, we're open, to those conversations taking place. We want those conversations to take place. You can't just rely on an external consultancy coming in and fixing everything for you. You need to, it helps, but you need, as leaders of organizations, to be able to really practice what you preach and drive that behavioral change from within, fostering those conversations. Generationally, we know we're in a working world at the moment where there are a number of generations in the workplace. Everyone struggles with their mental health. It's not just young people. The older generations will have their challenges, and whether it's coming up to retirement, whether it's mortgages that they've had for years, of financial challenges and pressures on them. We know that from a mental health and statistics point of view, that men seem to feel the stigma more and seem to feel unable to talk more, and seem to feel that they need to just plow on through, so to speak. But it affects women as well. So the point is that we need to increase that mental health literacy across organisations. We need to ensure that people know what resources are available to them, signpost them to the right resources, make those easy for them to access.
Yes.
Don't hide them behind firewalls. Don't hide them behind where you've got mental health care apps and things like that. Don't hide them behind, oh, you've got to register for this and register for that. Make it easy for people to access these things that we all have.
Yeah.
Support. It's communication is the key thing.
Absolutely.
Communicate. Whether it's resources available, that they know where to get them, that they know how to access them, that they're free and able to be accessed 24 hours a day. And we need to break those down barriers. It's speaking openly and honest with individuals across the organisations to break down those barriers, that actually we want to talk about this. We're able to talk about this. There will be many senior leaders that listen to this podcast and your podcast that you've done over the years that have their challenges themselves, that probably don't want to talk about it because they feel, oh, it's going to make me look weak or something like that. But actually, when you start talking about these as senior leaders, your staff realise, oh, I can talk about that.
Yes.
I can speak up about that. Oh, Tim's happy to talk about the fact that he's had gambling issues in the past.
Yep.
Oh, I know I can speak to him about any addiction issues or something I've got that I need support with. It breaks down those barriers that people aren't afraid to talk about what is a difficult subject.
Yeah.
And change isn't going to happen overnight, but normalizing that conversation that actually, it happens.
Yes.
It's around. It's not going anywhere. We need to normalise those conversations.
Yeah, absolutely. And you touched on something just now when you said, yes, you've got EAPs, you've got mental health apps, you've got all the resources, but make them easy, make them easy to access. And I think if that for me is fundamental. If you say to your employees, look, we have this option available for you, they need to be able to access it. They need to be able to understand how to use it, how to implement the stuff that they learn on it. Then that helps. And then there's that part where they have all that resource, they have all of those things that they can action. And then that comes down to their responsibility then as well, that look, I have everything, I can implement it. And I also know I can go and talk to Tim, I can go and talk to this person. Because again, it's the all round, it's the multifaceted. If the company provides, the employee takes it all on board, then you've got your compound effect of benefit and seeing progress for people. So I think that's really important, having easily accessible help rather than jumping through hoops to get support.
Yeah, and the fact of the matter is we need to be patient. We need to be prepared to invest in the important things. And when I say invest, that doesn't mean money. It doesn't mean you have to find budget for it. It could be time. It could be investing time. And whilst, we all use apps and things like that, there isn't a silver bullet app that's going to immediately make people happier at work. Some things work for some and some work for others. For me, becoming a more mentally healthy organisation it's a fundamental commitment to change the fundamentals, how you think, how you operate, how you work. It's not a quick fix. It's got to be a forever journey that will evolve over time, that will change over time.
Yeah.
There will be future generations that have differing needs as our organizations go through their lifespan. Technology is not going to fix it. In fact, I was speaking to someone yesterday where they're sort of going, in some cases, technology probably hinders a lot of things because we are so reliant on technology, whether it be a smartwatch that I'm wearing at the moment that's linked to my phone, that if an email comes in, it buzzes. We all go, oh, got to look at that. It might be important.
Yes.
We're reliant on alerts. We're reliant on app notifications. We've become so reliant on some of these technologies that, to a certain extent, on the flip side, whilst it's not going to fix everything, it can also be a hindrance in some way if not used, if not used effectively. And we're starting to hear stories now coming out in the press of some countries saying that actually employees have the right to switch off, in inverted commas, and actually, if they get an email outside of their normal, let's just say 9 to 5 freeze, their 9 to 5 working schedule, they are under no obligation to look at it, respond to it or anything until their next working day. You're starting to hear about things like that a lot in various countries around the world where they're looking to address that technological challenge, shall we say, and trying to make sure we don't lose that battle with phones and our attention span and the needs to be hyper responsive all the time, because that will damage and does affect our mental health.
And you know, that's, for me, that's a whole other podcast, and I couldn't agree more. That we absolutely could. That is definitely something that I talk a lot about in sessions with especially my teenage clients that come in and sit with me. You know, the impact that our technological world has on the mental health space, but that will be another one that I'll talk about at some point in the future, I am sure. But you know, we've just mentioned we're coming up to we're on 45 minutes nearly, so it's been a pleasure talking to you. Do you have any additional thoughts or recommendations that you maybe like to share before we close the podcast, just on how we can better support mental health of all workers and everyone overall in general?
Yeah, I think what I'd say, and firstly, thank you for inviting me. It's been a pleasure to speak to you. I think for me, it's just a short finish here. I think the main thing is when us as employers invest our time, curiosity, thoughts into our staff, into how we develop mental health support and mental health programs, it will undoubtedly help our people feel heard, listened to, and connected to that well-being culture throughout an organisation. That's got to be a win. So let's all just make a commitment to communicate with our staff, talk to our staff, and truly listen to them. Yes, we can hear what people are saying, but actually, are we listening to it and taking it on board and putting that into our day-to-day? So let's invest our time and energies into making our organisations the safest place for people to talk up about the struggles that they're having, ensuring that we all learn from each other. And yeah, as I say, that's going to be a win. It's going to make our workplaces better. It's going to increase retention. It's going to enable us to learn from each other, because even us as employers can learn from the struggles that people are having to adapt our ways of working, our support mechanisms. That's got to be a win for everyone.
Yeah, I couldn't agree more. And let's hope for a future where we do have better mental health within the workplace, with a mentally healthy culture, like we said, not only from managers but also from all employees, all staff, that we all just work together and we all implement strategies that help ourselves.
Couldn't agree more.
Definitely. Well, it's been an absolute pleasure having you on the podcast, Tim. So thank you once again. You've been a star. We've done a nice long episode and it's been brilliant speaking to you. As we wrap up this episode, I again want to offer my sincere appreciation for Tim for his time, and I want to leave you with a message of empowerment. This podcast is all about exploring various ways in which we can all gain control of our mental health with an employee or an employer. Now, I hope these interviews are helping to shed light on the ways in which employers and employees can all take some action to improve workplace mental health. And I really hope you enjoyed today's episode. Until next time, take care.